Hi, my name is Diana Sepulveda, and this is for my class Veterinary Nursing 2439.
Hi, for this part of the video, I'm going to show how to do an electrocardiogram on this lovely patient. What you want to make sure of first is that your paper that you need to print out the ECG records is full, and I did already check that. Then you want to make sure you set your patient on a plastic or rubber pad here, and then with some warmers and a towel to keep the patient calm and warm. Then you want to do is grab your alcohol, and you want to clean the area where you're going to put the leads on, and then one right here and some right there. This patient has pretty short hair, so it's not necessary to shave her hair. And this white one goes on the right front armpit axillary area, and then this black one will go on the left front axillary area, and then this red one would go on the back angular area there. Then you want to watch the ECG rhythm, make sure it's a steady pace and there's nothing abnormal. You can also ask your doctor to check to make sure. Then you want to do is print out a copy. Okay, and that's how you properly do an ECG. Oh, and also you want to make sure the patient's on the right side of their body, and then right lateral. Next part of the video, I'm going to show how to do a proper Schirmer tear test on her. What you want to do first is fold right here, so it's prepared for you to go ahead and put it in the eyelid. And these are labeled which one is right and which one is left. Make sure you don't touch the bottom part of these testers. And then I'm gonna start with the right eye. So what you want to do is go, excuse me, I'm gonna switch spots with you. Go right here. It's okay, sweetheart. Thank you. There you go. And then you want to make sure you hold it closed for about 60 seconds. You want to watch the timer. Make sure it's still in. Just a few more seconds. It's okay, sweetheart. It's okay.
I did. Yeah. As I said, I started
Okay.
on, I just won't be able to finish.
So it's been whole 60 seconds, and the test is reading at 14. Just make sure. Hold on. No, 15, which is normal. Now we're gonna do the other side. Okay, sweetheart. Just like that. Another 60 seconds. If the test would have been over 15, it is abnormal. But if it's also lower than 10, it's just saying that he has or she has a low tear production So that is also abnormal. What we want is it between 10 to 15 tear production. Okay, just a few more seconds on this one. It's okay, sweetheart. It's okay. Few more seconds. Almost done. You're doing good, sweetheart. It's okay, Mama. Oh, it's okay. She's back. She'll be back. Okay. Done. And then for this test, it is reading at 11. Still okay. You're normal. For this part of the video, I'm gonna do a fluorescent eye stain. Percocaine is optional. In this case, I'm not gonna use it. She's doing pretty good. We're gonna get a 3mm syringe and the stain. We're gonna fill it up with saline eye wash. Taking the stain. Then what you want to do is add a drop on each side. It's okay. And then you want to put a piece of gauze underneath and wash it off. Make sure they blink, like she has. She's like, why? It's okay. Thank you, Tony. Let me finish my mind. It's okay. There you go. There you go. Okay, and then we're gonna take it to a dark room so we can check if the stain took any uptake and if there's any ulcers. And we'll take our black light. Okay. Okay. Thank you. All right. Okay, mamas. Okay. And check the eye. As you can see, there is no uptake. Let me check the other eye. Meaning there's no ulcers. It's a good sign. And then if there were to be an ulcer, then sorry, it's dark. that would just let us know that we shouldn't do any medication with steroids, because that would just make it worse. Alrighty. For this next part of the video, I'm going to show how to properly do a tonometry. What you want to start off with is adding a drop of proparacaine to each of her eyes. Make sure it goes in. There you go. One more drop. Okay. Then you want to get your toner pen and put a new tonneau cover slip on it. Make sure you don't touch it. This tonneau pen is already calibrated, but I'll show you how to do that in the end. Since now there's two lines showing there, it means that it's ready. What you want to make sure is that the dog's nose is parallel to the ground, and that the holder that's helping you is not holding tight on the neck or under the jaw, since that can affect the results. And then you want to do is go straight where the pupil is. Okay, so that's under 5%. That's on the 5%. So that's good. So first reading is 11. I'm 17. Sorry, 17. Second reading is 15. One more. 13. So what you want to do is get the average of those three. So 17 plus 15 plus 13 equals 45. Divided by 3 is 15 on the left eye. Then you want to repeat the same process on the right eye. $13. $16. Okay, mamas.
For Gemma, this morning, whenever you talked to the husband, did you mention getting a 6 month or just a 1 month of That's Empirica?
1 month.
14. So 14 on the right, 15 on the left, and that is how you properly do a tonometry. Now for calibrating this, what you want to do is, I'm going to show you how to properly calibrate a tonal pen. So this pen didn't need to be calibrated, but I'm going to set it up to calibration so I can show you. So first you want to make sure that it doesn't have a cover slip on here, and then you want to do is go to where it says cal. Right there it says cal, and then you want to press again till it says up, like that, and then you want to go up, and then if it says good, that means it's calibrated. If it says bad, that means you just have to start again and try doing it slower or not too fast, and that way it's calibrated. And that's how you do it. That's how you calibrate a tonal pen. For this part of the video, I'm going to show how to properly do an enema on Maximus. So first you want to do is get body temperature water and mix it with some lube. I know, pups. Okay. Get sterile syringe. I'm using a 25 ml syringe. What I do is just like mix it and fill up the syringe. Then with the appropriate size of a red rubber catheter, this is the ideal size for him. I'll place it in the tube here. Oh, it's too big. A little bit more.
We still got drug orders to put up. There's refrigerated stuff that still needs to be put up.
Okay. And make sure there's no air in the catheter. Like that. And then what you want to do is lubricate the tip of the catheter. And with someone holding the pet, you want to feed the catheter in the rectum and flush it. This patient does not need an enema right now, so we're not going to proceed with the rest of this, but usually you want to do it is on a wet table and make sure that his rectum is where you'll be able to clean it up easily later. For this part of the video, I'm going to show how to do subcutaneous fluids on this dog. So what you want to do is get your fluid bag with the line. Make sure that the line is filled up with fluids before you inject it on him. Always put a needle on the end. I use a 20 gauge needle for him so it can flush faster depending how much the doctor is recommending. You can base your numbers on the side here, or you can also fill up a syringe with the amount of fluids that you need and inject it on the pet. For Russo, we're gonna use the line with the fluid bag, and we're gonna do about 50 cc. So right now it's 100. We want to go down to 50. Okay. So what you want to do is with your alcohol, part the skin right in the back, part the hair, sorry, and put some alcohol where you're going to put the needle in, so it's disinfected a little, and then unhook this like that. And then pick up the skin, go right under the skin, and then you want to press the bag and put the fluids in. Since we're using a little bag, there we go. That was 50 cc. And then what you want to do is just press down a little bit so he doesn't bleed. And once he's okay, you're good. That's how you do sub-Q fluids on a dog. For this part of the video, what we're gonna do is do a modified Robert Jones bandage on this patient. So the first thing you want to do is unwrap and rewrap your vet wrap, just to make sure that when you're putting it on, it doesn't go on too tightly and prevents any risk of the patient cutting out any circulation. Then what you want to do is create a splint with the tongue depressor and your adhesive tape. What you want to do is just put tape on both sides of the tongue depressor. Just like that. And then with the help of your partner, you would put this on each lateral side of the patient's leg. Then grabbing your gauze, what you're gonna do is start from the bottom, work yourself up, making sure you leave the toes out. Don't want to wrap those in. And always going halfway up each time, making sure that there is no dents or creases as you go up. And then with your splint on the side, always just making sure that you put the splint on top of the cotton and not on the skin, so that the splint doesn't cause any rash. Then what you want to do is tape. Use your tape adhesive to tape this so it stays in place. Oh, are you okay? What happened? Okay, sorry, I don't know what happened. Then you want to do is grab this and go all around as well, starting from the bottom, breaking yourself halfway up each time and leaving about 1/4 of an inch of cotton gauze on the bottom and on the top, making sure that there's no creases or folds, just like that. Then you want to cut this and then cut the splint with the vet wrap. Also working yourself from the bottom up, always going halfway up each time. When you run out, you can always start there. And then using your tape, halfway on the bandage and halfway on the pet, like that, on the bottom and on the top. On the bottom. Alright, and that is how you do a modified Robert Jones bandage with the splint. Now to remove it, what you do is just untape this part, the bottom part and the top part, like that. Then you could also, if you can find where you left off with the vet wrap, unwrap it like this, like that. Remove the splint. Then with your bandage scissors, with the dual side on the bottom, you want to go starting from the bottom, work yourself up, cutting, making sure you don't cut the patient. You can remove the bandage and it's taped. For this part, you can use some water if you want to, or if it just comes off easily, like that, shouldn't be a problem. And that is how you remove a modified Robert Jones band-aid with a splint. Alright, for this next part of the video, I'm going to show how to properly do an emergency bandage on this pet. So what you need is cotton gauze, cotton, this adhesive tape, vet wrap, and your bandage scissors. First, then let's just pretend as this dog has a laceration in his abdominal area, and it's not a real big one, but it is bleeding out a lot. So what you want to do is concentrate in that area and put more cotton there, so it adds like pressure, so it in a way helps the patient not bleed a lot. So before you start, you also want to roll out the vet wrap and roll it back in as fast as you can, so that whenever you're applying this, you're not applying it with too much pressure, and then it causes bad circulation of the blood. Okay, so you grab your stuff, you put it where the patient is having bleeding, then you want to wrap it around as fast as you can. Like that. Also remembering to keep about a fourth of an inch out. Grabbing your bandage scissors. Like that. Tuck it in. And then using your vet wrap. And then put in tape so that no liquid, half of it on the bandage and half of it on the patient. And doing the same on this side. If you run out, it's okay. You just grab another one and do the same thing. Like so. All right. And that's how you will do an emergency bandage, and making sure that there is actual cotton where the bleeding is happening, so that it creates a pressure, so you help the patient not bleed out too much, and you can have a better chance of getting them to an emergency hospital where they can have a better chance of getting it all sutured up. Alright, so for this part of the video, I'm going to show how to do some dental x-rays to use on this dog's carnasial. First you want to do is create a wrist and set it up on the computer. And I already did that and I have it all set up. Ready to go. I plug in my x-ray machine and it's already wired up. What you're going to do is grab one of these screens and put it right where you want to do it. I also put this tooth expander so I can this rubber thing so I can help me open his mouth better. I also put a towel right here for comfort and so that his head is tilted a little. I'm gonna put this right under here, and I'm gonna put some glasses underneath to keep it in place. Right there. And I'm gonna grab this. Making sure that it's gonna take view of that carnation. Okay, that looks good.
Take a big breath for me, please.
Yes.
Thank you.
Okay. And then what you want to do is come to the corner thing here and set it up for him. So he is a big dog, and we're gonna do carnation. And then make sure that nobody is around and stay 6 feet away before I shoot. We are 6 feet away, and I'm wearing my Dosimeter badge. And I'm gonna shout shoot so that everybody knows and is aware that I'm shooting the X-ray. Shooting! Okay. And then I'm gonna take my tag right here, rip off this part right there, and then go through my X-ray sheet. So we only have one big plate, so we're gonna use one of the little ones for this next one. These are all set. We're also gonna take another view of the carnation. I'll just place it where I want it to be. Make sure it's in the right spot. Yep. Okay. Then again, over here. Make sure everybody's 6 feet away. And everybody's wearing the Dosimeter badge. And then everything's set up for big dog and a carnation tooth. And then we start shooting. There you go. We'll take the second view. Put this up. And on this view, you can tell that this is the carnation right here, and then this is the exposure of the roots. This is the teeth behind it and the teeth in front of it, and a little bit of the exposure of the roots there too. Then I'm just gonna wait for this to open so I can put my view in there. Okay.
Yeah, don't worry about that. I know a lot of us are used to seeing pretty fat dogs.
There you go. And then you want to make sure you label your teeth. This is 208, and you want to label the teeth around it too. That's okay. Only the ones that you can see. This one is too far back. Alright, and then that's the view of the carnation and the tooth behind it, and you can see the roots right there. And you also want to label it and that tooth behind it. And that's how you do dental regs on a dog. In this video, I'm going to show how to do a manual plate scaling. This is the instrument that we're using. And this is how you would do it. You want to go right under the gum line and then down to the crown of the teeth. And then you just go like that. We'll do this one too.
Yeah, just stick that.
And just like that. And then you can use to blow away all the
Yeah.
plaque from the teeth. You use the air to pull it down. And that's how you do a manual plate scaling. For this part of the video, I'm going to show how to do scale a dental calculus from a dog using an ultrasonic scaler. Our scaler here uses a lever on the floor to activate it. And what you want to do is by using the side of the scaler, never the tip, scale from the gum line down. And you want to spend about 10 seconds on each tooth. Try not to go over 10. You can always just move to the next tooth and then go back to the previous tooth to finish off what you were doing. Just 10 seconds on each tooth. Okay. And alright. And that's how you do a dental cleaning with an ultrasonic scaler. Okay. For this part of the video, I'm going to show how to polish dog's teeth with using the polisher. Also, this part of the machine uses a lever on the bottom to activate it. What you want to do is just get a little bit of the dental paste and spend about 5 seconds on each tooth. 1, 2, 3, 4, 5, 6. You can get more from the tip of the tooth. Just go in there. Make sure you go in between the gums. 1, 2, 3. Make sure you get all that dental calculus, anything in there. Make it smooth. Again. And then you want to get your water pressure and rinse all the toothpaste off. You can also use the air to dry it off. And then you want to add your treatment gel and put it on the teeth. That's how you do. That's how you polish dog's teeth. I will talk to a client about home dental care. Okay, so for home dental care, you can have this handout. It just explains how we recommend you to brush your pet's teeth at least once a day. What you want to do is brush each side about for 30 seconds and go in circular motions. Make sure you get the top and bottom teeth. We do sell these toothbrush kit here in our clinic that you can use for smaller breeds, and it has a small and a big brush, and it comes with the paste. We also sell it individually, just with the finger brush if you have just a small dog. If toothbrushing is not a good idea for you and your pet would not allow it, we also recommend this dental gel that you can just apply to the gum line, and it will help kill bacteria, so it reduces the buildup of plaque in the teeth. Also, this water additive is something you can also use in their water. It doesn't have a flavor, but it does help reduce bacteria in their mouth as well. And we also have these two foods that you can use. Well, one of them is a diet that has dental care
products inside so that whenever they're eating, it can also help them. And then we also have these yummy treats for them. Most pets love them, but if they don't, well, we can just give you a sample so you can try them out. And then what they are is just a chewable, so they bite on it and it gets softer. And, and they will love, it will help them also reduce bacteria in their teeth, so they just take.
Awesome.
And, yeah, these are
Thank you.
No problem, thank you.